Everybody to the this week's edition of the Yamhill Leadership Roundtable. We're going to do introductions, and then we're going to turn it over to Congresswoman Bonamici. We have Mayor Scott Hill from the city of McMinnville. We've got Casey Kula, Yamhill County Commissioner. We have Kelly Mankey, Council President for the city of McMinnville. We have Steve Sugg. Oops, I need to let somebody in. We have Steve Sugg, who's the Superintendent for Dayton School District. We have Congresswoman Bonamici. We've got Alexander Hengen from the Yamhill Community Action Partnership. We have Scott Cooper from McMinnville Economic Development Partnership and his new facial hair. We have Councillor Remy Drabkin from the city of McMinnville. We have Al Bannon, field rep for Congresswoman Bonamici. And we've got Joya Goodrum from the McMinnville Chamber of Commerce. Welcome, everybody. And I am going to turn the floor over to our distinguished guest, Congresswoman Bonamici, who is tireless advocate for our county. I just want to point out. So welcome and thank you for being with us.
Well, and thank you so much for the opportunity. I always like to start by saying I wish we could be meeting in person, but we are, of course, doing what we can virtually to stay safe. Thanks for all you're doing to support the community. Thank you to my staff. I mentioned sometimes it feels like they're working around the clock because there's so many needs out there. And I know you are all too working a lot, long hours, making what are really difficult decisions, tackling impossible problems, a lot of things that have been existing issues and disparities, but exacerbated by the pandemic, of course, which has upended lives and affecting families, businesses, communities, nonprofits, local governments, as we know. And as I said, exposed and deepened a lot of the sort of inequities, but also disparities. And that's true in healthcare. It's true in housing, education, civic life. So during, of course, this unprecedented healthcare crisis, and then we had the wildfires on top of it. And it's just been very, very challenging. I don't get out much during the pandemic, but I did make a trip down to visit the firefighters in Newburgh and then to tour the site of the Chehalem Mountain fire. And I just have to say, I'm so grateful for the swift action of our first responders, our firefighters, volunteers, and Commissioner Kula and I went to tour the fairgrounds and talk to the people there who were able to, help step up for the community. And it really says a lot about the community coming together that we got through this in a way that was still devastating, but could have been a lot worse. So I know there's a lot of ongoing work to still assess the damage and to get things built back up, which has been really tough. So we also know that Oregonians are facing job loss and illness and grief over loved ones. I know things are really tough right now, and looking at the anxiety from across the district I represent, but also across the state and the country. I've been very alarmed by the increasing numbers, and I know things in Yamhill County today are dire. Hospitalizations. My next call or later this afternoon is with our Oregon hospitals because there's so much stress put on the system right now. I'm grateful that we had another emergency use authorization today for Moderna. So we have the shipments of the Pfizer vaccine already. Some has arrived in Oregon, and that's a milestone. And I'm grateful for all the work that was done at the FDA and our state and others to make sure that even though this was an expedited process, it is safe and there is light at the end of the tunnel. But as I've said, the tunnel right now is still pretty dark and pretty long. So I'm concerned about, the next weeks and probably months. We have a lot more work to do to address the spread of the virus, to support our communities, our frontline workers. And the way I look at it is that the pandemic hasn't ended and the relief should not end either. And that's why as we speak, negotiations continue. We came together in the spring as a Congress and passed a pretty comprehensive bill back in April, the CARES Act. But I have to say that if you had told us at that time that it would be mid-December and we would be where we are now with cases surging and hospitals filling up and healthcare workers stressed to the brink, I think we would have all been pretty surprised, because at that point in time last spring, it felt like we're going to get to summer and the cases are going to decline, and then by fall we're going to be back to some kind of normal. And we aren't, and we recognize that. So we're working to get that, another lifeline out there to families, to workers, to small businesses. We have to do this again. I had a telephone town hall meeting recently, and you can hear it in the voices of the people. They're very stressed. I had a single mom tell me, I'm home with my kids. I'm a home healthcare worker and I can't go into people's homes right now. I can't find childcare for my kids. I've been on a wait list for a year, and I'm terrified that my unemployment's it's expiring at the end of December. What am I supposed to do? And you can just hear that, that's just one story of many. So the House has repeatedly passed legislation. We've passed multiple versions of bills and sent them over to the Senate. We passed the updated HEROES Act that extended, this was just in October, the extended unemployment, additional direct payments, help with electricity, utility bills, and housing, key extensions for student loan relief, improvements to that Paycheck Protection Program to help our small businesses, and importantly, resources for our healthcare system and for vaccine distribution. And the Senate didn't act, so now we're back negotiating. We did last week pass a short-term bill to extend government funding through Friday. Well, that's just a few more days, and there's I think, general understanding that there's going to be an effort to tie a COVID relief bill to the government funding bill by the end of the week. We know we need comprehensive support out there. I am going to continue to advocate for the things that I mentioned, the economic impact statements, which, again, the pandemic hasn't ended. I had a senior citizen say, I got that $1,200 a long time ago, and I have extra expenses because I'm trying to have my groceries delivered, and what am I supposed to do? So I'm going to continue to advocate for those policies. I know that, as I mentioned, as we speak, negotiations are continuing. It's reassuring that they are bicameral, bipartisan negotiations that are happening. And Speaker Pelosi sort of called everybody together again right now to see if we can get something. The challenge is to get something through the House, through the Senate, and signed into law. That is the challenge, but we're up to the task, and we're going to continue to fight for that because we know how important it is for our communities. So I've said enough. I want to find out what's on your minds and see if I can answer your questions. I will give you a disclaimer that I do not have a working crystal ball, so I can't. I have an occasional text message from colleagues who are a little closer into the negotiations, but other than that, I can tell you what I'm working on and what I'm fighting for and what I hope the priorities will be.
Well, thank you, Congresswoman, for giving us that introduction. And it was only 8 minutes. So I did tell Al that you could have a half an hour, but we were like, maybe let's just get to people's questions.
Well, I don't want to talk to you for a half an hour. I would like to hear your input and find out places where we can partner and issues that you are looking for, and I can give you the best I can updates on where I think those issues are going to end up.
All right. Well, I think that Mayor Hill unmuted himself, so I suspect that he would like to ask you something. And then we'll go to Joya Goodrum immediately after that.
Great, thank you.
Congresswoman, thank you for coming on and the support that you give us and the advocacy that you do back in Washington, D.C. on our part. Casey just indicated that we had 8 deaths yesterday in Yamhill County, which is a sobering thought. And, our most vulnerable would be those that are in care homes. And Casey indicated that may be where these have come from. We all know that, getting through this COVID and, we thank for the vaccines that are on their way. We understand it's going to take many, many weeks and months to get it out to everyone that would have needs. But I guess my thought would be, to continue to advocate for us on the CARES Act. I'm most concerned, I think, with the businesses within our community that have just been devastated. Many have closed their doors completely, but there's so many that have made the right kinds of decisions to keep their expenses low so that they can still open their door at some point. But at a point when things start to break loose after the first of the year, to be able to support them and come back and have some type of support for our businesses, especially the lodging and the restaurants that really have been impacted. You've heard that message, that, but I would advocate that from a city perspective. That's the lifeblood of who and what we are in medium-sized communities like McMinnville and Newburgh is so critical. And so I don't know that you'd have any more than what you said, but that would be my heartfelt ask, is that we could just truly reach out and be supportive. I'll tell you, at the chamber, at MEDP, at the city, we're trying everything on our part, but we have parameters put around us. We had some care funds. We had $200,000 put out in the community. We were only able to use $57,000 because of the parameters put on the CARE Act dollars that came through the state. And we were willing and able, wanting to give $200,000 out for relief, but they just didn't hit the parameters. They'd had enough money that hit the statutory limits. So that's my story as mayor. I'll reiterate again that our people need to be safe. Mask, washing of hands, staying in as often as possible until we get through the point where we have the vaccine that can help us through this. So my 2 cents on that, but and I know you're connected, but any thoughts on the support of businesses would be helpful, I think, to so many on the line.
Thank you, Mayor, and I very much appreciate that and share those concerns, and I'll also appreciate, there's so many businesses that are doing the right thing and staying safe, but that's taken away their livelihood. And the whole intent of the Paycheck Protection Program was to make sure that these small businesses could get through and survive. Unfortunately, some of the original, it was a massive program, ramped up very rapidly. We have to have some accountability there. The money really is designed to help small businesses and make sure that they can get through this. And I hear your call for flexibility. That concerns me, that if there's money out there that could be used to help some of these businesses and it can't be because of barriers that don't make any sense, we need to know about that. And there have been bipartisan efforts to extend the program to make sure that the funding is actually going to the businesses that need it. My mom owned a small business. That was my first job, was working in a small business in a pretty small town. And I really understand the importance of that to the community and to the economy. So we're working on those issues. And you mentioned restaurants and the tourism industry, really hard hit, as have arts and culture organizations, places that have had to pretty much close down. And the Restaurants Act, which I'm happy to co-sponsor with my colleague, Congressman Blumenauer. Again, here's a piece of legislation that has bipartisan support to specifically help our restaurants. And one of the things that I want, and we recognize that other small businesses need assistance as well, but restaurants really have borne the brunt, because you can't go into a restaurant and eat with a mask on. Many of those other small businesses, you can go in and shop and leave and never take a mask off and stop the spread, but that's really hard when people are eating and drinking. So the Restaurants Act, we're trying to get the word out that it's not just the people who work in the restaurants. I represent the North Coast, the seafood industry. I mean, one of their big customers, restaurants. So when we look at the supply chain and all of the people who are affected, in addition to the people who work in the restaurants and the business owners, we know it's a really significant hit to the economy and how it will change the sort of fabric of our community if they can't open back up. So we're fighting for those changes. I do have a small business assistance team in my office, the people who on my staff who have collaborated to get together to help if there are some of these businesses that have specific questions. That we've done roundtable conversations with the Small Business Administration, and I know that coming up on these deadlines, people are really stressed about it. So I hope that within the next couple of days we have a positive message about legislation that's really going to help get them through, because the vaccines, yes, it's encouraging, but it's going to take a while. I do want to note, though, that there are also 4 other companies. So I don't have a scientific or healthcare background. However, I'm detailed enough to explain this, but there are 3 different ways that are being studied on how to attack the virus. And Pfizer and Moderna both use the same approach, and those are the 2 that have been approved. But there are also 2 other ways that are being studied and researched right now among 4 other companies. This is all part of the Operation Warp Speed. So hopefully we'll be able to get, other vaccines. I know Moderna is ramping up manufacturing as well. So, and then you mentioned also our seniors in long-term care facilities. I just spoke this morning with AARP and their advocates, really sharing the concerns about our members of our community who are in long-term care facilities. And in fact, AARP just published a national study, and there have been examples, across Oregon. It's a really, really tough situation because you have the combination of, caregivers often paid very low wages, and there's a lot of turnover, and they're coming and going, and many of the facilities don't, whether they be nursing homes or assisted living or independent living or adult foster homes, there's a whole range of facilities, and they might not have adequate PPE, and they have that staff coming and going and turnover, and not enough testing. So all of those issues are a serious concern. And as I worked on the Older Americans Act, which I'm happy to report passed both chambers and was signed into law in April to help our seniors. We did get provisions in one of the COVID bills to allow the long-term care ombuds people to get into, to have access to the seniors that are in those care homes. It may be virtual, but I just spoke with our Fred Steele, our Oregon long-term care ombudsman, and he recently sent a letter, as you may have seen, to the governor. There's still some serious concerns about people in long-term care and the situations in those care homes. So we're looking at it very closely, and I know that in the prioritization, of course, healthcare workers, but also people who are in long-term care facilities will be among the first. So thank you for raising all those issues. I hope I didn't skip anything, Mayor, but you raised some really good issues.
I think you really got a lot of them covered. And then Joya Goodrum from the McMinnville Chamber of Commerce has a question for you. And before I go to Joya, I do want to acknowledge that your staff are so awesome. In fact, Al got 3 face masks mailed to 3 N95s to an older woman who couldn't really leave her home to go and search for some. And so over the top. Okay.
No. Well, thank you, Commissioner. And the resident called and left a really nice message for me. She had called into my town hall meeting and said she's a senior citizen. She's really concerned about going out without an appropriate mask. And so we all connected the constituent and with Commissioner Kula, and we were able to get her a package of, I don't know if they're N95s or K95 masks, and she was very grateful for that. So yes, the above and beyond. So kudos to Al and the team for helping out.
Okay, Joya.
Thank you. Al rocks. We just so appreciate having Al here with us every week. So thank you, representing you very well. Thank you, Congresswoman, for being here today. It's always a pleasure to see you and hear what's happening in Washington. And I appreciate, I'd sent a letter to you last week, I think it was, and I got a great response back that I really appreciate. And so when it comes to the HEROES Act and the PPP, is there anything else in there that would be available to help businesses beyond the PPP. I know that the mayor had mentioned, and thank you, Mayor, for saying that, because a lot of people were blocked out of additional CARES Act funding if they'd gotten PPP or EIDL loans. And our businesses are really struggling. The recent closures for our gyms and fitness centers and the restaurants is really taking a toll. And it would be great, particularly because when it comes to the fitness centers, there's no evidence that says that people are really getting sick from fitness centers. It would be wonderful if we could have our fitness centers open. I know you don't control that, but I throw this idea out there. And I'd love to hear anything more that might be in the HEROES Act that could be helpful to our businesses beyond the PPP. And thank you so much for all the work you're doing. Really,
of course. Thank you, Joya. And the issue of the HEROES Act is that it is, we passed it in the House, but it's not the bill that the Senate took. They didn't take it up. So I can't say we're 100% starting from scratch with the new negotiations, but right, I can tell that from what I know, there is business support. I can't tell you exactly what it looks like, but I know that the issues that you raised about the concern about the lack of flexibility, and once you have PPE or once you got an EIDL loan, you don't still qualify. I spoke with businesses with the Hillsborough Chamber. Gosh, it was probably a couple of months ago, and they said, "What are we supposed to do? We got PPP, but we're out of funds and we still can't open, and how are we supposed to do this?" So yes, there have been proposals to say just because you got one PPP loan doesn't mean that you can't get another one. There's still, the pandemic is still here. So those are some of the conversations that are happening. I can't tell you the details because the negotiations really are in flux right now, but I do know that the helping the businesses and making sure that those businesses will be able to open back up when we get through this tough part. And vaccinations and PPE are all part of that. If the reason that the decision was made to say that you have to close your business is because people can't be safe there, more testing, more tracing, more PPE can help with all of those things. So I hope to be able to report details to you sometime soon. But right now, it's just in negotiation literally as we speak. So
may I just say thank you so much for saying that. If there's something you need from our business community, letters, whatever, testimony, please let me know. I'm happy to reach out and get people responding. Thank you so much for everything. Appreciate it. And have a lovely Christmas.
Thank you. You too.
All right. Thank you, Congresswoman. Councillor Menke from the city of McMinnville has the next question.
Hi. Thank you so much for being here today, and for Al, who does fabulous updating us on a weekly basis. And I just have a question. I know that the rental relief is going to come to abrupt halt at the end of this year, and I'm extremely concerned about that. Just for the average person, I mean, there's a lot of people that are out of jobs and things like that. Is there any plan as to how maybe to do a negotiated thing between landlords and tenants and provide some kind of relief for both, so that at least somebody gets paid something and the people can stay in their homes?
Thank you for the question. And there are efforts at the state level as well as the federal level. So when we've spoken about it, I know I have always spoken about rent and mortgage relief. And I've had conversations with, there's some people in retirement, and their retirement is funded because they have a duplex or a couple rental units. And if people aren't paying rent, they're absolutely affected as well. So it doesn't end, yes, of course, there are a lot of people who are struggling. I just heard from somebody who said he lives in an apartment complex in Northwest Oregon. He said the moving vans are here on a sort of regular basis because people can't afford the rent. I don't know where they're going to go. It's really hard out there. And I know many of you, Councillor Drabkin included, have been working on affordable housing for quite some time. And right now, during a pandemic, it's a terrible time to think about putting people out of their homes. So rent relief, but also that mortgage relief as well, has to be part of the conversation. And one of the reasons too why I've supported monthly direct payments, those economic impact payments, and continuing unemployment is that money goes right back into the community. People who are getting, an economic impact payment to help them get through a pandemic, or people who are getting that rent relief, they're not saving the money. It's going right back into the community. And many of them, if not most of them, are out of work through no fault of their own. So that is why all of those pieces were in the bills that we passed in the House, but not in the Senate. And I know I'll continue to advocate for those. As long as the pandemic is going on, we need that support out there to keep people in their homes and getting through this. If they can't go to work, they have to have some way to meet their expenses. But we certainly understand that just rent relief in and of itself doesn't work because the buck has to stop somewhere, and we don't want another huge foreclosure crisis. Which
is there anything going through the judicial system about a way of somehow negotiating this, so maybe the landlords get less, but the people can still stay in their homes?
Yeah, I don't know that there's anything happening in the judicial system at this point, except for maybe on a case-by-case basis where some individuals, but I know that it's part of the negotiations that are happening now as we speak, with the COVID relief bill that we're hoping to include in the called a omnibus bill that will keep government open until the end of 2020, the fiscal year of 2021. So it's not going to be, we did a 1 week extension just to get more negotiating time, but that's no way to run government. So we're hopeful that we can get this bill passed to get through the entire next fiscal year. So the conversations are there, and it looks like Senator Roeblen just joined us. And one of the things that I want to mention as well is I served in the Oregon legislature in 2009, and hi, Arnie, we thought that was a tough session in 2009, but one coming up is really going to be tough because revenues are down significantly. So that is one of the reasons why we've been fighting for that, the city and state support as well, because and not to talk about it in the abstract. It's not like the money is just going to go sit at the city or sit at the state. It's jobs, it's people, it's public services, it's our public health workers and our frontline workers and our firefighters and all the employees that are working to keep our communities safe in so many ways. That's who's affected by budget cuts, and our education, so which is funded by public money. So all of these things are reasons why I continue to fight for the state and local funding that will help not completely close the gaps, but there's going to be significant gaps if we can't get some help.
Thank you, Representative Bonamici. Thank you.
You're welcome.
And Congresswoman, I just want to bring in Alexandra just for a moment, just in case you aren't overlapped in time, because she's been doing a lot of rental assistance at YCAP, and I'm sure that you would love to hear more about it.
Thank you.
Congresswoman, it's great to hear from you today. Thank you so much for your time. I am here to share a little bit about our housing stabilization work and rent relief programs through our Community Action Agency, but I would echo, our conversation has been clear that mortgage and rent assistance is needed, and we've considered that through our state board of all community action agencies. And the ability for us to give this 1 to 6 month, rental relief to households across the county has been phenomenal. We've had positive results from both the clients that are coming to us and them having the ability to focus on other needs that might be coming up and have that security, but as well as landlords who have come to us and said, if this program was not available, we would not be in existence. Thank you so much for continuing to do this. Thank you for fostering positive relationships with us, being responsive, being direct. So we definitely support both and have seen the positive impact there. One thing I want to echo a little bit like Mayor Hill is that some of the parameters around the funding when it came through, there's definitely been some barriers, and we are hopeful that more assistance will come through, especially to a delivery system like the Community Action Network here across Oregon that would be geographically equitable and seasoned in delivering support. But we'd love to see a higher level of collaboration with service providers on what those barriers have been up till now, so that we can weed those out for the next round of funding and really, really get right and direct service. So there is limited delay. There are limited barriers in who we are serving to ensure that populations or households are not excluded. And I think speaking from YCAP, we're ready to have those conversations. We have lots of ideas. We are a small but mighty engine, but we're up for the task. So those would be my quick comments. I'm going to share a little bit more later and would be happy to connect if at any point in time you or your team would like some more information.
Well, thank you so much for the work that you're doing. I am a tremendous fan of community action, and one of the reasons that community action has been so effective over the years, and as you likely know, started back kind of in the civil rights era with community service block grants, is because the community service block grant funding does have flexibility and should continue to have that flexibility. And really, community action acts as sort of frontline entity to help address issues of poverty. And so I have been, over my time in Congress, advocating for increased funding for community action, but certainly during a pandemic when the work that you do is even more important. And I would very much appreciate being part of that conversation about where the parameters have created barriers, because I kind of start with the question of, on these parameters or barriers, like what is the problem they're trying to solve? Like why was that barrier created? And is it solving the problem it was intended to solve? And if it's not, let's take a look at why and get rid of it. I mean, if there are barriers that are standing in the way of people getting the help that they need, let's examine why they're there and take them down if we need to. So I really very much look forward to that conversation. And if there are any specific examples that you or anyone want to share with us at this time, that would be really helpful to know, moving forward. So thank you for your work. I know Community Action is very involved with the LIHEAP and other programs that help with utility assistance. We've heard, not in Oregon yet, but in some states and jurisdictions, there's water shutoffs if people aren't paying their bills. And, in a pandemic where people are supposed to be washing their hands, I mean, this is a terrible thing. So we're trying to expand that utility assistance to include water. Broadband is an issue, as you know, as well. So thank you for your work, Community Action. I really, really appreciate all you do. And please, I want to be part of that conversation.
Thank you so much.
Thank you.
And Alexandra will have more, but I wanted to make sure we got that in, since that's been a big part of the expansion of service this year for them. Councillor Drapkin has a question, and then we'll go to Senator Roblin. She raised her hand first.
Thank you, Senator, and thank you, Commissioner, and thank you, Congresswoman, very much for being here. I'm going to take your question about barriers, that even though that was in a housing discussion, and kind of bring it back over to the business side, just about some barriers to funds that I've heard from local business owners. One of them through and through has been timing. And, there's been so many different funding mechanisms, but timing has been a problem repeatedly. I think people are getting the information about applying for different funds, but then whether it's that those funds just disappear so quickly, a number of different systems have been kind of more first come, first serve. And so people don't even have the opportunity to get applications in. And that's even people that were prepared. I've heard from business owners that had all their documents prepared and ready, and then the funding, the application period closed so quickly because of the volume of applications that have gone in. And also, something that I haven't really heard discussed, but is definitely coming up for some people, is for whether it's business owners or for any number of these different funding mechanisms that have been coming down, right? Anybody that's delinquent in their taxes. I worked with one business owner. She's about 3 years delinquent in her taxes, and I offered to sit down and just do them for her, and said, we'll just get this all taken care of, and then you will be eligible. Your specific circumstance, there's no doubt in my mind that you'll be eligible. But there was a fear factor there that that even getting in attempting to get caught up to become eligible, she, and I've heard this from others as well, might end up with a tax liability that they simply couldn't take on right now because their business has been repeatedly closed, their business is down, and of course their business expenses are up. So just that's some feedback that I have heard to try to answer that question you posed.
Thank you, Councillor, and I appreciate that. And the first come, first serve has been a big concern, particularly after the first serve tranche of PPP money. When I know that people were very frustrated by seeing like the Lakers and Ruth's Chris Steakhouse and these big businesses were getting help, and the corner store or the coffee shop in my town wasn't. So that was very, very frustrating, and which is why we came back and we actually passed another piece of legislation that had designated really guardrails to do a better job in making sure that we were getting to the smaller sort of minority owned, truly small businesses, which is really the intent of the program. So I know there's a lot of call for accountability and really looking at where a lot of those dollars went, because if businesses that didn't need the funding got it, and truly small businesses that qualified did not because they weren't early enough in line or there just wasn't enough to go around, that's very concerning. And with regard to the disqualification and the fear factor, I mean, that's concerning as well. It sounds like in the case that you were helping with, that somebody just needed that counseling to be able to say, look, we're going to help you through this. And that's been true, I know, with some of our SBA reps and like the business assistance team I mentioned in my office. There is also the undocumented community that has really been left out of the federal funding over my objection. And that COVID doesn't know if somebody's undocumented. Like COVID is affecting everybody, and then oftentimes it's the Latinx community and people of color that have been disproportionately affected. But I know the state stepped up with the Oregon Worker Relief Fund, but that was not unlimited either. So there's a fear factors there as well. So thank you. I'm glad you brought these issues to my attention, and hopefully I'll have some positive news about additional support for our small business community. And in the next couple of days. So I'm somewhat optimistic, but also we've been trying to do this for months, and now the time pressure is on. But I hope that results in the support that our communities need.
And thank you, Congresswoman, for bringing up the undocumented community, immigrant community in general. So many small business owners in our community, in our county, have in some way improper documentation, and they're part of our community, part of our economic infrastructure. So thank you. Senator Roblin has a question or a comment for you. Probably like reflections on time together.
It is great to see you, Congresswoman Bonamici, and thank you for your input. I want to say that you are gracious in accepting all of the responsibility for some of the stuff that went wrong with some of the business loans. A lot of that came from the state because you gave us the money and then we figured out how to give it out to the people. So it's a bigger question to look at some of those distribution of money actually was done by the state level from the federal money. I really am happy that you're considering moving forward because we are in really bad shape statewide if we don't get some more help, relief. It's going crazy. I was late today because we were on a caucus meeting. The governor called a special session for the 21st. I had mentioned to people that we might be doing it. There are 3 bills plus some money issues. We're trying to put about $500 or $600 million into the e-board so that we can do some stuff between now and the end, including rental relief and some other things. But the 3 bills have to do with LC 10, which is a restaurant relief during this deal. LC 18 is residential eviction moratorium and landlord compensation fund. And I wish that people anyways, the conversation about if you take care of the landlords, you also take care of the others. So having both of them is kind of weird sometimes, and it makes it difficult for people to know which one they should be taking care of. And then LC 21 has to do with limiting school liability, and we've also been talking about limiting medical liability, but it's currently not in it. For everybody on this call, just so you know, on Thursday and on Saturday, there is an expectation that we will be having public hearings on all of this information for a new committee. That's the committee that will deal with all the bills for this special session coming up. So it's a special session, special committee, joint committee, both House and Senate. They're going to have some hearings over this kind of stuff. We're expecting that we will come in on Monday, the 21st at 8 o'clock in the morning. And we'll do whatever housekeeping stuff we have to do. And we have to do that in public and in our seats in our both respective sessions to open the session. Then we'll go back to our offices and sit. Mine is very vacant, so I'll sit quietly, watching the TV, because the committee will have to go and take those bills and start working on them in a committee session. And hopefully by the end of the day, depending on how all this works out, we will come back to the floor to vote on the different bills that will come out of that special committee and then come home. As you know, because you got to be in special sessions a lot back in 2003, probably more than we've ever done. So there is always the chance that things can go weird in a special session. Getting in and out is important, and hopefully we have worked on what it is we're going to talk about, and that special committee hearings that are happening on Thursday and on Saturday. I don't know the times on those yet. We'll get the information that we need to move forward. But the rental assistance and the others is really important. There's people with thousands of dollars of back rent right now that are due, and figuring out how to make landlords whole who are some in foreclosure of their own properties because they haven't had money to pay, and getting people out from under the unbelievable thinking of how do I pay back 12 months of rent, which I've never been able to pay, barely been able to keep up with 1 month. What am I going to do? All of those anxiety producing things need to happen. And we aren't going forward, but we are looking at, I think, extending it some period of time, probably 6 months, to wait through as we work on figuring out how to get out of this pandemic. And any assistance from the federal government towards the states and to all of these things is really going to be appreciated and actually very needed, because we're going to take $500 million out of what we had as a carryover from this session to spend in the short term. That's money we won't have for the next biennium, and it's going to be tight. So anything you can do to help would be great. And it's really great for you to spend your time with all of us. So thank you very much. And I hope that your husband is doing well too. The courts have been active this lately as well. So
well, thank you, Senator, and thank you for all your years of service. I know you will be missed, but I wanted to thank you, and thank you for giving us an update. I hope that by the 21st, we have some news for you about what we are able to get through. There has been some talk about separating out the city and state funding from the rest of the package and pairing it with liability reform, which you also mentioned is one of the concepts you're looking at. Obviously the concern about liability reform is like, what does the specific language look like? Because even though, most businesses are doing the right thing and doing everything to keep people safe, you look, nationally at some of these big like meat processing plants and, some of these big businesses that have really put, that profit above worker safety, and, just sends a pretty bad message at a time of a pandemic that we're not going to have any responsibility for the safety of our workers or customers. So how is it drafted? What does it do? How long does it last? How broad is it? So we're looking very specifically and carefully at those provisions, but I hope that, and we don't know if that's going to stay a separate bill or if it's all going to get put into one. But hopefully by the 21st, you'll have more information that will be helpful, especially with the restaurant, because the Restaurants Act is a piece of legislation that has bipartisan support. and has been included in the negotiations. So I'm hoping that gets over the finish line as well. When you said at the beginning of your remarks, Senator, that the federal government gave the money and it was the state, I thought you were going to be talking about unemployment compensation.
No.
Because that has truly been a challenge. And
Yes.
I know they're taking another stab at updating the system, but it's hard to find people who still know COBOL to keep it going. But that has been a real challenge. And my office typically does not do unemployment. Our constituent casework is usually federal, Social Security, Medicare, Medicaid, immigration. We've done, I think Marshall's done close to 1,000 unemployment constituent cases because there's so much need out there and people have been really frustrated. So my message, and I've given it to the Oregon Employment Division as well, as please fix this. So.
We have to get that fixed. And though I will say that part of the problem is we've been working on constituency issues forever on unemployment as well. And every once in a while, you'll finally get it dug down and you'll find out that the person quit their job. They weren't eligible for unemployment, but you've spent all this time, energy, and they made the right decision in the first place by denying it. So, I mean, it's right. Everyone is an individual case, and it's really tough. And
it is tough.
We should have fixed the system. You gave us the money from the federal government 10 years, over a decade ago. And that's really disappointing that we didn't get that done.
Indeed. Well, and also in all fairness, that the unemployment system was not designed for a pandemic. It was not designed for that number of people all at once getting into the system. And then with the pandemic unemployment program that we passed that expanded unemployment to those who didn't traditionally have access to like an employer, the gig workers, the independent contractors, that kind of thing. That was a new program to ramp up. So in all fairness, there were those considerations as well, that it wasn't designed for this type of situation, which looking back, benefit of hindsight, there's another approach that many European countries did. It's called the paycheck guarantee or paycheck recovery approach, where instead of spending all this money giving it to unemployment or employment offices and trying to get it out through the unemployment system, it was more of a direct payment. During the pandemic, you just pay people's wages to keep them employed, which also has the advantage of keeping them connected with their health coverage. Because here in the United States, where we have employer-provided health coverage, if somebody loses their job, they're also separated from their coverage. So then you have the COBRA issue and how expensive COBRA is, which is one of the justifications for the additional $600. People say, well, what, the people don't need an extra $600. You know how much COBRA is? It's expensive. So the paycheck, with the benefit of hindsight, looking at more at a big picture approach that would have probably been more efficient and more effective. When we have to keep that in mind in the long run, that you have to maybe think big and say an approach that's actually going to be more effective, especially dealing with a healthcare crisis. Separating people from employment is not a good idea with the healthcare system that we have and the unemployment system we have.
I would like to note, Congresswoman, that I believe that it wasn't really hindsight for you. I seem to recall that you were supporting that as early as I can remember. So, yeah.
Well, and I looked at it and it made sense. It required there was strategic, big, but it would have, thank you, Commissioner. It would have saved a lot of heartache.
Yeah, absolutely. And I do want to acknowledge here that the pandemic unemployment assistance, especially for 1099 filers, in my world of small businesses and farming, so many people that I know never would have qualified. And the relief in knowing that their farmers market or their crafters market or their, just their independent work, their carpentry businesses, that they were going to have some money has been so much of a relief. So thank you for that. I mean, it's really, I think of my entrepreneur friends, and they never really considered that they might just be left dry. And so thank you. I
appreciate that. Yeah, a lot of people didn't consider, we didn't think we were going to have a pandemic. So we've certainly learned a lot during this process. It's been heartbreaking in so many ways and so many lives lost. But we have learned a lot about, the inequities that existed in healthcare and housing and education and access. And the list goes. And so when we're looking at, the start of a new administration, which I think yesterday was a kind of a milestone, and the recognition that the election is over, we're moving on to a new administration. Hopefully these lessons learned will be part of the build back better. That let's not just put these issues behind us. Let's keep them in mind to try to close a lot of these gaps as we're moving forward, whether that be in educational dollars or how we deal with healthcare. We had a good conversation yesterday with Congressman Blumenauer and several of my colleagues in Congress and former Governor Kitzhaber about the healthcare transformation that Oregon passed that set up our CCOs and how that's actually working in rural areas to make sure that we're getting healthcare to people. And so there's a lot we have learned over this process, but again, it's been very, very challenging, and a lot of people have been personally affected. Our communities, everyone's been affected in some way or another, and way too many lives lost. So here's hoping for as I mentioned, the light at the end of the tunnel. But please, everyone, it's going to be a tough holiday season. All of us have to make sacrifices. I am not seeing my family. My daughter, I'll see my daughter on a Zoom screen, just like I'm seeing you. I let my son come over only if we sit outside because he's an essential worker. And so, those are tough things. I feel like the mean mom is like, yes, kid, you can come over, you must sit outside. But we all have to do what we can to stay safe, and we'll get through this. And I hope that the effort is out there in the community as well with the vaccines to make sure that they're equitably distributed, and we have some education work to do about the safety and efficacy of the vaccines. And I know that there's already a sort of vaccine resistant community in particularly in Oregon that we're going to have to work with. But did you have a question, Councillor Dropkin?
I did. Thank you, Congresswoman. It intersects with your current point, which is I've been thinking about how to frame it, and I haven't quite found the words, so excuse me as I stumble through this a little bit. But we have, been experiencing a lack of leadership in many ways in terms of acknowledging the vaccine, encouraging people to wear masks. And I mean, everybody is aware of that at the federal level. We're certainly feeling it in many avenues in the local level as well. Not to be pointing fingers, but quite frankly, I mean, we have county commissioners that have refused to wear masks in public meetings, defying state orders, and are posting pictures of themselves, and commissioners-elect posting pictures of themselves, defying state orders, and we're seeing it mocked. And the mandates that are coming through, and then the trickle-down effect is that there are large swaths of the community that somehow still think this is a hoax or a government conspiracy to do what? I don't know, kill business and make people wear masks. I haven't figured out why, how the government conspiracy part is justified. But I do think I do think that, there's, I don't know if there are ethics violations that are wrapped up in this, or I don't know how to address it. But if we can't get local leadership even on the same page, I don't know how we continue. I don't know how we get our constituents to buy in. I mean, and the self-policing aspect is very, very tumultuous. And I have to tell you, there's not a single time that I go to the grocery store, which I grocery shop for my parents as well, who I haven't been in their house. I see them outside on their doorstep. but every time I go to the grocery store, there's at least one person that's not wearing a mask. And you can see, yesterday I actually heard a person that was working at the grocery store say to themselves, I don't want to deal with this, when they saw the unmasked person, and turn around and walk away. So that's a lot. But what advice, or what, I know you don't have a crystal ball, but how are we going to get more consistent messaging out to the community so we can end this sooner?
I appreciate your comments, Counselor, and I experience it too. I mean, I have colleagues who only put a mask on when they walk onto the House floor to vote because they have to, and then they immediately take it off. And it is heartbreaking, but and I'll try to be somewhat diplomatic here, but it is from the leadership at the top, or lack thereof. If we had, from the very outset, if Donald Trump had said to the public what he said to Bob Woodward, that this is serious, it's real, it's more serious than the flu, we have to take it seriously. That's what he was saying in private, but not publicly. We'd be in a very different situation, because so many of the messaging came from the top and came from those examples. And so I think with the new leadership coming in, more education efforts, our public health people and our public health offices, and all of us as members of the community just have to have those sort of heart-to-heart talks with our friends and neighbors. But it is as you said, tumultuous time. I mean, we had people threatened yesterday across the country on their way to cast their votes as electors. That's unacceptable. We, unfortunately, in too many places in this country, are at a point where people are not resolving their differences through peaceful dialogue. Of course, there are differences of opinion and differences in how we solve problems, but the lack of civility is very, very concerning. So I hope that, with a new messaging, today, Senator McConnell recognizes that Joe Biden will be the president of the United States. And I think we're going to start to see people saying, okay, let's turn the page on this chapter. And I think everyone has to realize, I've had colleagues on the other side of the aisle from me who have come out of the hospital and said, whoa, this is serious. You have to take it seriously. So as people start, seeing their friends, their neighbors, they have to understand that it's a real pandemic. Yes, there is hope. I think that the message that so many are going to help spread about the importance of vaccinations is going to be a key piece as well. But we'd all be naive to say that it's going to be easy to get through this in light of how divided the country is. But all we can do is to each do our part and try to have those conversations and build those relationships and educate each other, and just continue to try to work for, getting back to the days where we could have a disagreement about something without threats and violence. So all I can say is I'm going to continue to do my part, and I know you will as elected leaders and community leaders as well. And I appreciate all you're doing. I do know that I have to get on another call in 2 minutes, but just wanted to thank you, and especially acknowledge Senator Roeblen for your years of service. Thank you so much. Arnie, really nice to see you. Everyone, I hope this didn't end on too gloomy of a note. It is a really serious time, but I know you can all find a way to have a safe and very happy holiday season. And I look forward to continuing the conversation with you all soon. Take care, everybody.
Great. Thank you very much, Congresswoman.
Thank you.
It's funny, I was about to say, Counselor, I was going to have the last thought with a real bright, warm, cheery thank you thought. So way to bring us back down to earth, as it were. But it is an important conversation to have. So I appreciate you bringing it up, even if it is hard. And what I hope to do along those lines is to use the roundtable to disseminate accurate information around the vaccine and how it's being distributed, both in the state and in the county. So there'll be more to come on that. it's I think a good opportunity. So we'll make sure that we have Director of Health and Human Services Manfred on here soon for that. And I'm glad that Alexandra got to have a moment to talk about rental assistance, because she doesn't get to have a total overlap. But Alexandra, tell us about the work of YCAP in the last 9 months in as many minutes as you can make it.
All right, I will do my best. Thank you so much for having me today. I came into this conversation hoping to give you a broad overview of a couple of our key efforts around housing stabilization and homelessness, pretty much as we get to the end of the year here and some of those deadlines around COVID-related funding. What I can say right now is our agency is just very much boots on the ground. All we're focusing on is getting direct assistance out to our community members, kind of gathering data and doing reports and getting on these calls has not been the focus of our team. So I hope that some of the information I can share today gives you some insight into where we're at, and we certainly will come back to the community and partners to share more specifics. But again, we're here for the clients, the community members that need help now. We're not here to try and delay that in any way. So I will get to rent relief. I saved that one for last. I'm going to talk about a couple smaller programs first, and then I'd be more than happy to answer questions at the end. I think most of you are aware we have been operating for about 1.5 years, the Shelter Collaborative, which is an effort to bring all shelter providers across Yamhill County just to one table to discuss barriers to shelter, concerns about shelter, shelter capacity, resources for data tracking and training and safety and supplies, best practices. So that group has remained active during COVID. Obviously, it was initially about PPE and appropriate policies, but we're back at the table. And as of this month, we're focusing on doing some surveys on shelter beds and working with HHS on preparing our unhoused and sheltered folks to receive the vaccine. So Director Manfred has reached out to our teams. We're currently doing some information gathering. That could be as early as January or February, we have heard. But again, it's a population we want to make sure has access, and there is intentional planning around, and HHS is definitely leading that. So YCAP will continue to support them in any way possible, along with the rest of the collaborative that's jumping in on this conversation. We did previously share that we this winter engaged with 2 local shelters to try and increase inclement weather beds during COVID and this winter, and both of those partnerships have been successful to date. We are discussing efforts with a 3rd shelter, but ultimately this leads us to 400 shelter beds for the winter season versus 326 in our previous season, which is great to see at least that increase during this time when it's challenging for everybody. And maybe all of the projects and partnerships we would have liked to have seen didn't quite get off the ground. We were still successful in some very key ones. And we're continuing to look at these partnerships and provide staffing support for shelters, data support, training, any supplies, just an open line of communication. And of course, plugging them back into our coordinated entry system, AnyDoor Yamhill, which I think this group is familiar with. There's a direct phone line to screening for anyone who's precariously housed or is actually unhoused. And there's an online screening as well. So we've maintained that and definitely seen some increased traffic in that. I'll talk about that a little bit later. Great news that we were able to announce a while ago is our Motel Project that started March 17th, 2020, is funded through April 2021. This is 20 beds that we have been able to solidify at motels at 3 locations across Yamhill County. So we have 2 in McMinnville, we have 1 in Newburgh. Just going to give you guys some data points on that. Right now, we have had 74 total households served to date. That encompasses 128 people. That's 107 adults, 21 children. So we are seeing families. 40 of those households were senior households, 55 plus. Again, this is for unhoused folks who are at greatest risk for COVID, and we did work with HHS to establish some screening parameters and how to place people on a priority list for this program. And to date, we still are only placing, 100% of these households have chronic and severe medical conditions that really put them at risk. So far, out of the 74 households we've served, 53 have exited the project. And here is what is the mind-blowing part, which I have discussed, I think, with some of you individually, but our most recent stats at the beginning of this month say that 74% of those 53 have exited to a positive location. These are percentages and statistics we did not even anticipate being part of this project when we started it. That's up from, I think, 64 or 68% is what we last were sharing with people. So to know that it's continuing to increase, those positive housing locations could be a YCAP housing project that we run across the county, a transitional housing placement. Several have gone to rehab facilities or reconnected to natural supports such as family. But the great thing is overall these people are taking positive forward steps for their household. And the environment that we've been able to create in placing people in motels with case management, with food support, that holistic approach seems to be a key factor here. The 21 households that still remain in the project doesn't mean that they're not engaged. That's another thing that we really enjoyed seeing throughout this process. They are engaging with us and working through barriers. So of the 21 left, we have 11 that have already been enrolled in other housing projects or connected with a housing choice voucher, which means they're housing resource. They're ready to go. All we're doing is searching for that placement if we can find it in the county. So that's exciting. 4 of those other households are working with their case manager to increase their income high enough so that they can self-pay for housing. So they're doing intentional planning around that. And then 6 households are actively working to figure out what kind of housing plan they can come up with. So I don't have any disengaged households in that project right now. It happens for a household here and there, but we are blown away by these results. We're excited about this program. It will have run for over a year by the time the funding we have right now expires. We're certainly open to additional funding. It's been a great relief to the owners of the motels, being able to keep their rooms full. And it's been a great relief to our community. And obviously it's done a world of amazing things for our unhoused folks who have entered the program. So we hope to provide at a later date, a full analysis and lessons learned out to the community. But of course, we're just focused on keeping people safely housed and taken care of and keeping the momentum on what we're seeing. One small note is, we initially suspended street outreach during COVID because of the risk and not knowing what was going on and wanting to keep our staff safe, but we have fully resumed street outreach and we have hired a second outreach worker. So we have 2 for the whole county, but we've divided it by regions and we have updated our postings on consistent places that they will be. So if you do have questions or you want to connect directly with an outreach worker and find out how to engage with them, how to refer to them, how to best work with them. All of that information is on Facebook, but it's also on our website. Email me if you need it. I will get it to you. But we're trying to double our efforts and we're still interfacing with other outreach teams. We have our community health workers. We have the teams from Providence. So we're definitely still keeping those lines of communication open so that we cannot miss anybody during this really challenging time. A lot of people have had questions about the upcoming pit count, and we will definitely be releasing a press release in the next couple of weeks, but it is definitely going to look different this year. The Rock Balance of State is not going to be supporting a pit count during COVID, which means some of the apps we would normally use out on the street and data gathering is not going to be available. We did get last week HUD confirmed they're going to provide an exemption with a guarantee that not completing the pit count in 2021 is not going to impact our funding in the next year. Kind of up in the air is our state funder, OHCS, and HUD, what that's going to look like past next year, if there will be some repercussions. Initially, we were told the state would reduce our funding 10% because we didn't have an up-to-date count, but they recently came back to the table and let us know that they're going to try to work with us individually so we don't get in that scenario. YCAP has been really excited about trying to find a way to do the pit count safely and be creative. So what I'd like to share with you guys today is a couple of our top strategies and what that will look like come January. We do intend on completing a full shelter count. So obviously it's not going to include the vast community canvassing or drop-in spots. It is going to be shelter specific, but the fuller we have that, the better. We're also going to ensure that the same type of street survival gear and the survival kits get out to the unhoused in the community, no matter whether we get a pit count or not. That survival gear is essential. So we will have a small group of volunteers and our outreach staff and case managers who will ensure that there's a delivery system for that in January when the need is great. In January, we're going to have a focus on trying to partner with as many people getting entered into coordinated entry as possible. That's where our by name list lives of who we know is unhoused or about to be unhoused, and any information we have on contacting them. So all of our team is going to kind of reassess their time and make a huge push to get as many names as possible entered there. And then we're going to put in efforts into some rapid resourcing and additional supports that we can do without a pit count. Ultimately, we think through these are our top priorities. We think that we can still inform partners across the county on what the status is of homelessness to the best of our ability in Yamhill County is and what some of the needs we're seeing arise through this work. So it definitely will look different, but we're not going to totally give up on our efforts here. So I want to dive into the rent relief a little bit. YCAP is putting out a little bit over, this is not an exact number, 1.6 million by the end of this month just in rent relief alone. That came from some state funding, that federal package that came out, a large grant with OHA and a couple of smaller ones. We are down to less than 30,000 that has to go out the door. I anticipate that will be committed this week, if not early next week. So we have no concerns about expending it in full and meeting that obligation. At the end of November, we had 310 households, which encompasses 938 people who had received rent relief, either 1 to 6 months of relief for their household. We have been doing 1 to 6 months depending on their situation, and ultimately, some of these households have also been able to get payments into January, which we knew was the last month that we could extend them into. 2 weeks ago, OHCS notified us that they were now opening it up to February. So not all households have security into January and February. A lot have January covered in Yamhill County, the ones that we've interfaced with, and a few now have some February coverage now that we have that permission to extend. So what we do know is it's not going to be enough. And I mean, everyone on this call knows that it's not going to be enough. We believe that another package of about the same size is going to be needed for the impacts in the first 6 months of next year. The households that we're seeing, the majority are below 50% AMI, and quite honestly, a lot of them below 30% AMI. The parameters were expanded to 80%, but we haven't seen a lot of 80% or close to 80% households. We assume that they're seeking additional supports from family or community and have been able to find ways to make it through until now. Same sort of stories you guys have been hearing, loss of their job, having to stay home with childcare. They've been required to quarantine or have had COVID more than a short-term period and been dealing with illness. Most of these households have been 2-income households and they're used to living paycheck to paycheck. So they've had some sort of loss, 1, 2, or 3 different levels of loss, and it's just impossible for them to make these rental payments. I can say I've been blown away. These clients are grateful. This does not feel like a program that missed the mark, that was an abuse of the system, that let people slide or take advantage. These people are working intentionally at different levels. You should see the plans that they are crafting with our case manager. They will find what resources they have. They are contributing to the process. And they are incredibly grateful. They're incredibly engaged. And this is a meaningful support for our community. Likewise, landlords have continued to reach out to us and send us emails. We would not have been able to keep our lights on and pay our bills had you not been covering this rent. So we've seen it as a win-win, especially if we fostered those positive relationships with landlords. They've been interfacing with our case managers. We'll get on the phone with them. We'll help them with documentation. Whatever we need to do, we want it to be a good outcome for both, because that's the whole picture of our community. Let's see. So this week, knowing that funding has been running out, we have started to create a separate list of households that we know are not going to be served. We have let them know transparently that they are on this list, and that if there are funds, we will distribute those funds, but there is a great chance they are not going to have the funds that we need. We are looking at our regular homelessness prevention dollars from other programming that we normally run and trying to displace that and prepare smaller packages of support for these households. But it is going to look vastly different. I'm not going to be able to issue 3, 4, 5, 6 months of rent to actually stabilize that household. It is going to most likely be piecemeal on what's available, but they can qualify for 1 month, maybe a month and a half. That kind of decision making, it's going to be a little bit different. We were notified by the state that they had an additional $12 million in COVID rental funds that were available that had not been expended, and came out to the entire Community Action Network to see if we had expended funds in either general funds or other state sources where we were trying to use them for CRF related activities. Could we make a shift? And then they could distribute some additional CRF dollars to our agencies. YCAP did find a decent sum of funds that we had used in other buckets that could be relieved. We've put that forth to the state. We're just waiting to hear back if they will meet those dollar numbers, which is going to open up, some ESG funding and some of the out of the cold winter shelter funding that has a longer timeline for us. So that will help greatly through the January, February, March assistance period, where we're going to have a lack of funds and we've run out of rental assistance. So I'm hoping for positive news in the next week or two. Hopefully very quickly here. Again, I think, we really would like to see an additional rent relief package come through. It's been successful for us to deliver it through our coordinated entry system. We are receiving over 100 calls a day, which is not enough for our one staff who normally mans those calls and does all of that work. We have secured a little bit of funding to increase to a second staff person to do that, with a specialization in rapid resourcing. And we are also putting a competitive application in at the end of this month to expand that second position through June 2022. So we know coordinated entry has already seen an increase during COVID. Community members are accessing it. We want to ensure its efficacy and reliability remains the same. So we'll keep you posted, but still a great place to have people call in and get screened and get connected with any housing resources. We have continued to run all of our normal housing stabilization programs during this time. To give you kind of a scope of what our agency has been dealing with, looking at the end of October, the dollars out the door for clients assistance was almost 3 times what we had done at that point in time last year. But if we looked at our staffing was less than 5% increase. So that trend is going to continue. I'm not kidding when I say we're small but mighty and we've been creative. So we will continue to do that. But also in light of that, we're really hopeful that if there's discussions at the state level for additional federal funding that comes down to the state, or state funding that gets earmarked for additional delivery, we've learned a lot of lessons, and we have a couple of thoughts on what that could look like. We really do want an established and geographically equitable delivery system to be considered. And I think community action agencies have proven that. We have great resource amongst each other across the state. Creating a new delivery system in the middle of a pandemic or emergency, or trying to expand to partners who may not know what they're getting into, has been a little bit risky and concerning to us. So again, we think that the Community Action Network could definitely be very reliable. We also would like to see some of the decision-making around the parameters around the funding be influenced by guidance or feedback directly from service providers. We've had concerns about different populations being able to access the funds, and the guidance put out about that, such as the undocumented population. We've had concerns about delays and how we're allowed to spend the funds, and what that can look like, where funds have been issued and they're on the table and they're finally in our accounts, but we haven't been told what we can spend them for just yet. And monitoring is serious business. When it comes down the line, if you can't get a guarantee that you're not going to have to pay back hundreds of thousands of dollars, unfortunately, sometimes agencies are frozen in that moment and can't move. So we'd like to create a conversation where we can say, here's how service delivery might happen even faster, and here's how we may avoid some of these periods of kind of being immobilized and stuck for a moment and not delay this kind of service in our community. One of the things that we think was also a challenge is there was very, very limited and sometimes zero staffing support for our agency, which is why you've seen we haven't increased anything, and we've had to be creative on how in the world are we going to get these dollars out the door. And as a key delivery agency, we don't want to burn out our staff, and we don't want them to be gone. We want them to be here. We want them to be prepared. And it really does matter when you get that staffing support, indirect support. So we're hopeful that when decisions are made, we can look at how agencies can remain healthy and their operations can remain sustainable. Certainly, at some point, certain agencies that could be smaller than us or about our size may have to make decisions on the risk of accepting funds without the proper support, and nobody wants to be put in that category. We certainly saw a couple agencies across the state that were had boards that were concerned. We may not be able to deliver these funds because it's going to drain other funding sources, or we don't have the funding sources to backfill it. And that's what we're being asked to do, which is impossible. So again, we want that to be part of the conversation. Final consideration is YCAP does try to engage as much as possible in culturally specific partnerships, but we hope that if another package comes down, that will be a discussion that can be engaged in on a local level, not necessarily required to be the exact same in each community, because Multnomah County and Clackamas County and Washington County are going to look very different on who is culturally specific in Yamhill County and what their capacity is during COVID. Nonetheless, we have some exciting partnerships that at another time I hope I can share about, and it is a focus of ours, but we do want it to be local solutions, which is what community action is all about. So that is a lot of quick information for you all. I think until the next package, YCAP is here. We're focused on service. We're open to any discussions across community if there's an opportunity for partnership or leveraging support dollars getting out of the door, whether it's from municipality or other grants. We just know that we're not quite in the end stages of COVID, and we know that what we'll see with the clients we serve, those impacts are going to ripple throughout months and years to come, and we want to be here to help mitigate that as much as possible. So that is what I have quickly to say.
Awesome. Thank you so much for that explosion of information. And I hope that Al was taking good notes. And Councillor Drabkin has a question, but I wanted to address Joya's about to jump off the call. And yes, I'll be hosting again next week, and I'm going to try to get Director Manfred on to talk about vaccine distribution. All right. Councillor Drabkin.
Thank you. I was just wondering if you could expand a little bit on why the point in time count. You said something about the app not being available, but why that isn't happening, and then also if there's anything the support that you could use in terms of making it happen, or is it just off the table?
It's off the table. So the continuum of care, the balance of state took an official vote on it, and they would have supported the app. We've been in discussions for the last couple of weeks, and different agencies were giving their feedback in their communities on what is possible and what is not during COVID. And ultimately it was decided not to move forward with it. So we feel that it's a good decision. YCAP felt that they could have moved forward with it, but not all agencies could. And that's why we've identified those other priorities to basically do our best and still be out there and still engaging with key needs.
Councillor Drabkin, do you want to follow up? Or are you good?
Is that it?
Okay. Yeah, and it makes sense then that reaching out to the shelters, for example, you're still going to get numbers even if you don't get everybody. And as a member of one of the street teams last year, actually, we didn't find anybody who hadn't already been interviewed when we were on the street.
And sometimes weather is a factor. If it's raining, we may not get everybody. So we're going to focus on the coordinated entry by name list, which again is something that our funders have said would potentially be appropriate so that we don't lose funding and we get some sort of count. And we'll focus on the actual sheltered count.
Okay, any other questions for Alexandra? And thanks everybody for sticking around until later than normal. I wasn't going to do a roundtable though after Alexandra's presentation, but if anybody does have something that they really want to share we're still rolling. So, and especially Senator Roblin, you've got big meetings coming up here.
I do want to say, though, that I am very impressed that Community Action has something to do. And that was really a nice presentation, by the way, with a lot of really important information. So thank you for that. And thanks for all that you guys are doing to help those people who really need that help. Yeah, we have a lot of meetings coming up. So that's exciting. They're keeping me busy till the end of my career. So I have appreciated that. So I'll get at least one more emergency board meeting as well, because they're putting money into it so we can have a meeting. So that'll happen before the 10th of January when I finally end my career at the legislature. So they're keeping me busy. I actually hope that people, if you're interested in any of those bills, will listen in, and you can make comments online with regard to the three bills that are coming up in the session. So anything.
Can I ask how you listen in? Is it on Facebook or how?
Yeah, Legislative Information Services. If you go to the Capitol and look under, I guess it's, I always get there. So
isn't it olis.or.gov or something like that?
Yeah. OLIS is the organization, and then you'll look and you'll find out committees, and then you'll look at special sessions, and then there'll be a list of committees, and under the committee you'll find this was special committee for the third special session. So
sometimes it takes a couple of click to actually get to the right spot, though.
Yeah, it does, but it is OLIS. If I'll try to figure that out sometime and let people know.
That sounds great. Thank you. Anything else for the good of the county? And Al, thanks for sticking around to take notes on Alexandra's comments, because I feel like it's really important when crafting these big policies to know, like, this is what a service provider is stumbling over.
Yeah, absolutely. And it was a great update. Thank you, Alexandra. I really appreciate it.
Yes. Okay, well, I am going to sign us all off then, if anybody unless anybody has more comments. But I really appreciate your presentation, Alexandra. We talk a little bit every once in a while about what YCAP is up to, but it's good to hear exactly from you. So thank you. And next week, we will ideally talk about vaccine distribution in the county. But in the meantime, stay safe out there, and know that everybody who's here is working for you every day, and reach out to us if you need something.
So are you going to get yours first? Or you get the first vaccine in county?
I am neither old nor a frontline healthcare worker nor a congregate care.
County commissioner. That doesn't stand for something? I can't believe it.
That's right. Now I have to think about it.
Okay, there you go.
All right. Well, thank you, everybody, and we'll see you next week.
Yeah. Bye-bye.